Hello and welcome to the HIV care and treatment modules of the Healthcare Service Delivery chapter of the MSM Implementation Toolkit, or MSMIT, a tool that offers practical guidance for implementing comprehensive HIV and STI programs for gay, bisexual and other men who have sex with men. This training is brought to you by MSMGF, the Global Forum on Men Who Have Sex with Men and HIV. This module introduces tuberculosis care, which is one among the 4 HIV care and treatment approaches presented in this module. It is listed with the other approaches here for your reference. This module introduces tuberculosis care and treatment for MSM. Tuberculosis is commonly referred to as TB. Presented here is an overview of this module, which introduces 3 topics. 1. A definition of TB. 2. The connection between TB and HIV. And 3. TB treatment recommendations. Tuberculosis, commonly known as TB, is an infectious bacterial disease caused by Mycobacterium tuberculosis and most commonly affects the lungs. It is transmitted from person to person via droplets from the throat and lungs of people with the active respiratory disease. You may be wondering why TB and HIV are so often mentioned together, and why in many countries HIV services are located within TB treatment facilities. This is because co-infection with both HIV and TB is extremely common. People living with HIV are 26 to 31 times more likely to develop TB than those who are HIV negative, and they are also at an increased risk of dying from TB. Given the disproportionate impact HIV is making in MSM communities, TB is a problem that needs careful attention. There is limited evidence to show that MSM living with HIV are at any more risk of developing TB than others living with HIV. However, incarcerated MSM or those who use drugs are more likely to develop TB. The 2012 WHO Policy on Collaborative TB HIV Activities, Guidelines for National Programs and Other Stakeholders recommend a 12-point package of interventions known as the Collaborative TB and HIV activities. The aim of the package is to establish and strengthen mechanisms for delivering integrated TB and HIV services, reduce the burden of TB among those living with HIV, which includes intensified case finding, treatment of latent infection and infection control, and reduce the burden of HIV in TB patients. The WHO's policy recommends that all people living with HIV should be screened regularly for the following 4 symptoms: current cough, fever, weight loss, and night sweats. If they do not report any one of the 4 symptoms, active TB may be reasonably excluded, and in resource-limited settings, they should be offered isocyanide preventative therapy, IPT, as treatment for latent infection for at least 6 months. In settings where resources allow, other shorter treatment regimes are also recommended. Those reporting one or more of the above-mentioned TB symptoms should be evaluated for TB and other conditions. If TB is suspected, WHO-approved molecular tests such as Expert MTB, RIF, which is a rapid automated test that also detects resistance to rifampicin, one of the drugs used to treat TB, are recommended as the primary diagnostic test for TB in anyone living with HIV or at risk of drug-resistant TB. Given that TB is one of the most common AIDS-defining illnesses, WHO recommends that all TB patients are offered HIV testing and counselling as a priority if their HIV status is not already known. If an individual is found to be living with both TB and HIV, WHO recommends that they should be started on ART as soon as possible, irrespective of CD4 count. Early ART significantly reduces the risk of mortality from HIV-associated TB. This concludes the TB module. Be sure to go through the other HIV care and treatment modules.